Also at the ARC's annual conference were Novartis. More broadly known for pharmaceuticals, Novartis had on display their augmented reality headset which, when used in an educational setting, allows students to walk through in 3 dimensions of the brain in a patient with multiple sclerosis using MRI data. What makes this more unique is the 4th dimension of time, to give the ability of students to see the progression of the disease over 10 years.
January 2013. The patient experiences a clinical relapse.
Let's now see inside MS and hear about the collaboration with Sydney Neuroimaging Analysis Centre, also known as SNAC, and the Hatch design team.
My name is Rob Walker. I'm Associate Medical Advisor in the Neuroscience team at Novartis working in multiple sclerosis.
Hi, I'm Stefan. I'm the Medical Manager for the Neuroscience portfolio in Novartis. This device has been developed in Novartis in order to try to improve the engagement of the doctor and understanding the disease, understanding how MRI can be understood by a patient and how we can improve the way how the patients can understand MRI.
I mean, this is an augmented reality display, and I think the important thing that you get out of viewing data, or in this case a patient's MRI data, is that it's very immersive.
The McDonald 2017 criteria permit a diagnosis of relapsing remitting multiple sclerosis, RRMS, to be made at the time of first clinical presentation based upon evidence of dissemination in time on brain MRIs.
This is a very complex disease, and what's important about it is you can see changes in MS with MRI data. We can demonstrate over a very long time, in this case 10 years, just how the brain changes. And that's a really important message for people trying to understand MS for the first time and understand how changes in imaging data, in MRI, correlate with changes in what the patient experiences. So we feel this could have a really important role in educating the next generation of neurologists about MS.
I wanted to show you the traditional way we would demonstrate a patient's MRI to them or to, for instance, a medical student. And this has now become a very critical component of a consultation with a patient, taking them through their MRI data, because a lot of the disease activity in MS and other brain diseases is subclinical. In other words, it's not overt, the patient may not be aware of what's going on. You do an MRI scan, it provides a lot more information, so it's very important to convey that to the patient. And the way we would normally do it is show a 2-dimensional representation of the brain, which is divided into slices, I'll start at the bottom of the brain down here, and then as I scroll up, you can see the slices going up the patient's head, eyes being at the front, nose, back of the head, ears on either side. Right is left, left is right. And in this case, this is in fact an example of multiple sclerosis, and you can see the typical periventricular, around the ventricles, as they're called, white matter lesions, and these are patches of inflammation and scarring, or sclerosis, which gives the disease its name. But without domain knowledge, it's very hard for either a student or a patient to look at this sort of 2-dimensional representation and come to grips with what the disease is doing, what parts of the brain the disease is affecting. And so we do this, and I do this on a daily basis with patients, but it is very difficult, and the patients clearly, when they're looking at this for the first time, are quite perplexed by it. So we wanted, with Novartis, to develop a tool that was able to convey or impart this sort of information to the patient in a format with which they would be more comfortable, or at least would be more meaningful to them. And of course, a 3-dimensional representation of the brain is much easier to grasp, and using augmented reality, virtual reality, or tools like that is something that really allows the patient to sort of become heavily involved in their own disease, and a student to come to grips with what is happening in the brain of a patient with a disease like this in an instant, rather than having to learn or come to grips with the details of MR imaging, which is something that takes a degree of time.
Well, when we first started looking into what sort of tool we could develop to better educate on multiple sclerosis, the first thing we did was approach 2 different parties in addition to Novartis. One was Hatch Australia, a group who helped us understand innovative tools like augmented reality. And another were some key experts in multiple sclerosis, so Professor Michael Barnett and Dr. Timothy Wang at Sydney Neuroimaging Analysis Centre in Sydney.
So my name is Peter Thompson. I am the co-director at Hatch Australia and I am the experience maker within the company.
And I'm Michelle Mencken. I'm a creative strategist.
What we're finding with this tool is that people are able to understand what's actually going on by the three-dimensional visualisation of it a lot better than they have been able to with their existing MRI scans.
The journey with them has been one of trying to figure out what should the medical story be that best shares an educational story for student doctors and potentially patients on what it looks like as new lesions form in the brain over that 10-year period, and also what are the other trackers we should be identifying through that journey, whether that be from an EDSS score to the medical treatment they were receiving, whether it's injectable or orals, and what other information can we provide along the way, including some of the MRI scans when there are relapsing points, etc., through that patient's journey.
My name is Tim Wan, and I'm currently the Director of Operations at Sydney Neuroimaging Analysis Centre, and I'm also working as a Research Fellow at the Brain and Mind Centre in University of Sydney.
And I'm Michael Barnett. I'm a Professor of Neurology here at the Brain and Mind Centre at the University of Sydney. I direct the Multiple Sclerosis Clinic here, and I'm also in charge of the MS research stream at the Brain and Mind Centre. In the context of our discussion today, I also work closely in collaboration with the Sydney Neuroimaging Analysis Centre, and in particular Tim Wang in the development of these collaborative programs between the BMC, University of Sydney and SNAC.
This key partnership between three parties ensured that we had a great clinical perspective in terms of how MS changes, and actually getting our hands on some really important patient level MRI data. Partnering with SNAC, we were able to really get a great clinical perspective on how the tool could be designed, and also working with Hatch, we got an understanding of how best to communicate that to a new audience.
The first time we presented this type of device and the model was in last May in Melbourne, and then we presented this prototype, because it's still a prototype, to top healthcare professionals, the neurologists that are seeing patients every day, patients with multiple sclerosis.
Most used word in this meeting was wow.
One of the interesting things we've done here is the Inside MS tool, and I think that's a great example of a tool that can be used to teach students.
I mean, I would like personally to see this put into university teaching courses, and that is exactly what we're doing here at the University of Sydney. We're going to try and put that into our neurosciences teaching block, where we teach patients and we teach students already about brain imaging and brain disease, but not in this fashion. This could be used in any chronic brain disorder, whether that's neuroinflammatory disease like MS, neurodegenerative diseases like Alzheimer's disease, or even malignancy, brain tumours, for instance.
Yeah, so basically, from the technical perspective, how this tool can be achieved essentially just needs a simple MRI scan, structural MRI scan. Then we can put all this using the analysis technique we have and construct this model and put into this tool.
We clearly identify that Novartis is wanted to be more and is more than a pharmaceutical industry, but really being a healthcare industry. And then for that, we really wanted to add value of the product we are giving to the patients. And this type of education tool, our objectives is improve the quality of the use of the medicine, is improve the outcome for our patients. And adding that on top of what we deliver every day to the doctors and trying to help the patients with the treatment we are developing, adding these type of tools will definitely improve the quality of the use of medicine, will improve how the doctors will treat their patients and identify the best patients for the best treatment.